Sure. So apo-CIII is a compound that works through an siRNA mode of activity. So this is a gene silencing drug. We silence the expression of the apo-CIII protein that is made by the hepatocyte. And normally this protein is involved in the inhibition of triglyceride metabolism, both in the periphery, so at the endothelial lining, but also at the liver, where it inhibits reuptake of triglyceride-rich lipoproteins. By silencing the gene that is responsible for the expression of apo-CIII, we're able to lower the levels of apo-CIII that are bound to these particles circulating that are carrying triglycerides. And by basically taking our brakes off, or taking the brake off the processes involved in metabolism of triglycerides, we're able to reduce the level of triglycerides in the bloodstream through enhanced hydrolysis peripherally at the endothelial lining, and then also enhanced reuptake at the liver. So this is the mechanism by which apo-CIII reduces triglyceride levels. Well, there's a couple reasons. CV reduction is one of them, that triglycerides, and particularly the remnant particles that are present after triglycerides are partially metabolized in the bloodstream, are highly atherogenic. And so reducing the level of these circulating particles and the levels of triglycerides is important for risk reduction. Very high levels of triglycerides are also associated with a risk of pancreatitis, and there are patients that have problems with recurrent bouts of pancreatitis related to triglyceride levels, and so reducing the levels, in theory, should be able to reduce the risk of pancreatitis and also reducing the risk of cardiovascular disease. Right, so the data that we've described so far is the ability to administer a single dose of apo-CIII and show silencing of the gene target, and we do this by measuring the apo-CIII levels in the bloodstream. So compared to placebo, we're able to show deep and durable reductions of up to 94% of apo-CIII, so that's reductions of the gene target of about 94%. And then we're also able to measure how that impacts triglyceride levels. And the reductions in triglyceride levels, triglycerides being the more clinically meaningful measure, are between 60 to 70%. So about a 90% reduction in apo-CIII correlates with about a 60 to 70% reduction in triglycerides. And again, that's with a single dose. Sure, so the studies are ongoing. The study was designed first to start in healthy volunteers. We required that these healthy volunteers had slightly elevated triglycerides at baseline before they received any drug. And the data from this study is what we'll be presenting here at HAA from the healthy volunteer dose escalation component of the study. We also have, in parallel with the healthy volunteers, data in the studies that are ongoing in a patient population. So these are patients with severely elevated triglycerides. They have to have a history of triglyceride level greater than 500 mg per deciliter, which is severely elevated. Those studies are ongoing, and we anticipate presenting some of that data at a medical meeting down the road. The apo-CIII data that is being presented at AHA, again, this is escalating single doses in healthy volunteers, many of whom had modestly elevated triglycerides at baseline. We're presenting the apo-CIII reductions, so again, the reductions down to about 90% in serum levels of apo-CIII, the corresponding reductions in triglyceride levels of about 60 to 70%, and then we'll present summary safety data as well. The drug was in the healthy volunteers so far has been safe and well tolerated, and we think sufficiently enough to drive further development in phase 2, phase 3 studies. Sure, so it's administered through a subcutaneous injection, so just an injection into the skin, usually around the abdomen or the back of the arm. We, looking at the single dose data now, anticipate that dose frequency could potentially be every 3 months to every 6 months. So it's not something that has to be administered daily or even weekly. This is a quite infrequent dose administration to patients. I think so. I think this represents one of the most cutting-edge areas of research in lipidology, in modification of cardiovascular risk factors. There are other gene silencing approaches that are being studied to lower LDL cholesterol, in addition to our compound, apo-CIII, which focuses on triglycerides. We have an additional compound called ARO-ANG3 that may be able to lower LDL cholesterol, as well as other cardiovascular risk factors, triglycerides included. There's another drug called AMG 890, which is an siRNA therapeutic that Arrowhead has licensed to Amgen that targets the lipoprotein A, also a cardiovascular risk factor. So this is really an exciting time for novel therapies in the cardiovascular space.